Hi, my name's Dan, and I'm a nurse with Revere University. I'm going to be conducting an assessment. This is Laura. Starting with her head, I'm just going to look at her face and look for symmetry. All right. And I'm also going to make sure that her head is normocephalic and there's no trauma. You have no recent trauma to your head at all, no TBI, anything like that. All right. Can you give me a big smile? All right. Can you raise your eyebrows for me? Make a sad face. Okay, good. So as she was doing that, I was noting that these creases were symmetrical. Her eyebrows went up, and that her face was able to move, and it was equal on both left and right side. I also noted that her ears both rise at the same time when she smiled, so I can tell there's a lot of symmetry there. So now I'm going to feel around her head. So starting with here, I'm just feeling for tenderness. Do you have any tenderness when I do this?
No.
All right. Any be feeling for any instability or crepitus, and also feel for the suture lines here and make sure that everything is just flush. Okay. All right. So then I'm going to move down to her jaw, temporal mandibular joint. Okay. So if you can open your jaw for me. All right. And I'll also be feeling for tenderness, instability, and crepitus. All right. So open your mouth, go side to side, and now stick your jaw way out. Was there any pain while you did that?
No.
Okay, none. Feel for a temporal pulse, and then I'm going to listen to see if I hear any auscultate for any brew. So, all right, I do have a positive pulse. On this side, it's strong, and I do not hear any brew. Same thing on this side. All right. And I don't hear anything. So I'm also going to feel for a carotid pulse while I'm here. So I got a strong carotid pulse on this side, and I'm just going to do the same thing, listen for brew. Nothing. All right, I'm going to feel on this side. I do have a strong carotid pulse. And I do not hear anything. All right, I am going to note that she does have full range of motion on her jaw, and I'm going to move on to her hair. So on the surface, you can tell that her hair is clean, evenly distributed on her head. It's light brown. There are no bald spots noted, and as I inspect even closer, I'm just going to go through the hairline really softly, and I'm looking for any dry, flaking skin, any abrasions, any lesions that may appear abnormal. I'm also looking for parasites like head lice or bed bugs, anything that would be out of the ordinary. So then I'm going to move on to her eyebrows, okay, and look at the rest of her skin. I'm just going to note that her eyebrows, they're even across and symmetrical bilaterally. The hair is evenly distributed, and I'm also going to note there's also vellus hair on her face that's evenly distributed. It's a little, it's not thick, but there's more intense as it goes near her hairline, but it isn't terminal hair. Looking at her ears, there's no terminal hair. There is hair, and then also on the back of her neck. She has light vitelliform hair all over her body. Now I'm just going to take a quick look while I'm here, looking at her her knuckles. The hair's still pretty light, and she has no terminal hair noted on those areas. All right. So moving down to her neck, I'm just going to look at her inspector trachea, make sure it's midline. So if you could, I could see that it's right here. It's not deviated to the left or the right. All right, so I'm just going to watch you swallow here in a sec. All right, could you swallow for me? All right, and here I could see that she was swallowed and it was symmetrical. So also, I'm just going to feel her thyroid. So what I'm going to do is come back here. Can you tilt your head that way a little bit for me? All right, and I'm going to feel on this side. And I note that her thyroid is right there. All right, yep. Yes. All right, can you move the other way? And I can feel her thyroid on this side. And it's palpable, and I can tell that it's symmetrical on both sides. There's no swelling. There's no tenderness when I touch it, is it?
Nope.
All right, her head, I'm going to start checking her lymph nodes. Okay. So starting at the preocular, I'm just going to feel on both sides to see if I feel any. All right, and then I'm going to work my way down to the tonsillar, which is right under here. And what I'm really feeling for is if I could palpate them. If I can palpate them, that means they're enlarged. They're probably going to be round and tender. So if you have any tenderness, just let me know. And then I'm going to move on to the submandibular, which is right here. All right, and while I'm feeling that, I'm just going to hold the top of her head and go to this side. And then I'm going to feel the submental, which is right here. Then I'm going to switch to the postocular, which is back here. All right, and then I'm going to work my way down this way. So to do this a little bit better, I'm going to have her turn her head, and I'm just going to observe the anterior triangle here. So as I'm working my way down, I can just feel for lymph nodes. All right. All right, now I'm going to switch sides. Go to this side. All right, I don't feel anything. Nothing's palpable. Nothing's round. No tenderness when I palp. Okay, so now I'm going to go to the occipital, which is back here. I go down to the posterior cervical chain. All right, can you turn your head this way? And a note on this side. Once I get here, I'll try and palpate the supraclavicular lymph nodes. Okay. I don't feel any. Can you turn the other way? All right, I'll do the same thing on this side. All right, so now I'm just going to feel, if you could turn your head that way, it just relaxes it. I'm going to see if I can find the inferior, down the, and I don't feel any swelling or tenderness, nothing round. All right, so I'm going to start here and start palpating for the lateral and central lymph nodes. Okay. Okay. And then work down to the subpecular, to the pectoral, and I don't see any there. Then I'll work my way back to the subscapular back here. Okay, and I don't feel any. And then I will feel down here the epitrochlear. See if I feel any lymph nodes there. Nope. Any tenderness when I touch? No. All right. No lymph nodes swelling. As you know, she's pregnant. So, all right. So I'm going to feel for femoral artery. All right, and coming along the crease here, I can find the superficial, inguinal, and horizontal and vertical. All right, and I'm just feeling for those lymph nodes that are down this way. And I don't feel anything there. All right, same thing. I'll feel for a femoral pulse. I'll come up this crease. I'll work my way down. And again, no tenderness, no brown lymph nodes, and nothing is enlarged. So Laura is a Caucasian woman with light fair skin. Her skin is clean. You can feel it. It's warm to the touch. All right, and it's intact. There's no excessive dryness or sweating, and her skin's not oily. So when I touch her skin, I note that it's blanches in areas. So there is good circulation. I will note that she's not pallor. I don't notice any cyanosis anywhere. Her skin feels smooth to the touch. I'm going to check for skin turgor, and it's quick to recoil. The elasticity is there. It moves in all directions. Same thing. Check for skin turgor. It's quick to recoil, and the elasticity is there. It moves in all directions. No lesions noted. Do you have any open wounds that you want to tell me about? No. All right. There's no jaundice. Just look at the sclera of her eyes. Can you open your mouth for me? I know there's no jaundice in the roof of her mouth. And upon my inspection, I didn't see any rashes or any abnormalities. Oh, wait a second. Here we go. So we do have a small mole. So when I'm inspecting the mole, I'm going to note that there is some terminal hair coming out of it. This lesion for symmetry and roundness. So it's relatively round. It's a little oblong the long way. The borders are well defined. All right. It is the same color all the way through. It's brown. I don't see any black or blue. It's not open. I'm going to measure this for diameter. My ruler, I'm going to note that it is 9 centimeters or 9 millimeters by 6 millimeters, so it is oblong and oval. So have you ever noticed this mole before?
Yes.
Alright. Has it changed or has it been the same way?
Same.
Okay. I'm just going to feel it one more time. So I'm going to note that it is slightly elevated. It's soft, and it hasn't been growing progressively over the last few weeks now. Okay. So on the last part, we're going to inspect your nails. 15 minutes. Okay, so what I'm going to look for here is that the nails are well kept. They're clean. There's rounded edges. I'm going to note that all of our nails are pink, and you can note that there's a Luna on each one. You see these? Yep. Cap refill is less than 1 second in all her fingers. And there's no deformities, no tenderness noticed when I touch these. Okay. I'm going to just do the Shamuth sign. So the Shamuth sign, what I need you to do is take your nails and do this. Alright. And as I note, there is a less than 160 degree, so there's no clubbing, and there's like a diamond in between that. No leukotokia noted, no parachia, no pitting, no spoon nail, no Bose lines. Thank you for your time, and you have a good day.